Infants fall down, they fall off of things, they roll off of beds and tables, and so we want to talk about infant head injuries found on page 17 of the textbook. If our infant falls or falls off of a table or falls off of a bed, we always want to perform a primary and secondary assessment. We really want to check our infant out. And we perform that primary assessment and we call 911 for any life threats that we find. Our infant may have a bruise, and if our infant has a bruise, then you can apply an ice pack to that. Don't apply ice directly to the skin. You always want to put a piece of fabric between the ice pack and the infant's skin. If the infant lost consciousness, even for a few seconds, any length of time, we're going to want to call 911 and get our infant immediate medical care. If our infant did not lose consciousness, go ahead and perform that secondary survey. And you want to be looking for any types of head trauma or bruising behind the ears or around the eyes, things like that. If you see anything like that, any type of bruising, or you see fluid leaking from the ears or the eyes or the nose, then the infant requires immediate medical care, so call 911. But you may not see anything. The infant may not have lost consciousness. And so if that's the case, we want to continue to monitor the infant. And we want to look for any one of these signs or symptoms. Seizures, any difficulty in breathing, any change in consciousness, or vomiting, acting strangely or less alert. We see any kind of deep cut or bumps or skin or lips that look blue or purple or gray. Any kind of severe or increasing pain. Any mouth or facial injuries, persistent crying, refusal to eat. If the soft spot begins to bulge, or if the infant repeatedly vomits, these are all signs that our infant requires immediate medical care. We want to monitor our infant for a good 24 hours. Be looking for any of these signs at all. And if any one of these signs appear, then we need to take the infant to the hospital immediately. Call 911. And of course, as always, if you have any concerns whatsoever about the infant, please get the infant immediate medical care so a doctor can check them out.